Welcome to Med Madness, your go-to channel for in-depth medical insights. Today, we're diving into the topic of secondary hypertension, a condition that's critical for medical students to understand. Secondary hypertension differs from primary hypertension as it results from an underlying, identifiable cause. Knowing how to identify and manage this condition can significantly impact patient outcomes. In this podcast, we'll cover the definition, causes, pathophysiology, symptoms, diagnosis, management, and treatment options, and we'll also present a case study to illustrate a real-world example. First, let's define secondary hypertension. Secondary hypertension is defined as elevated blood pressure due to an underlying medical condition. Unlike primary hypertension, which has no identifiable cause, secondary hypertension can be traced to specific health issues. Common causes and risk factors include renal parenchymal disease, renovascular disease, primary hyperaldosteronism, obstructive sleep apnea or OSA, pheochromocytoma, Cushing syndrome, thyroid disease, primary hyperparathyroidism, coarctation of the aorta, and the use of oral contraceptives, especially in those with a family history of hypertension. Now, let's explain the pathophysiology of secondary hypertension. The pathophysiology varies depending on the underlying cause. For instance, renovascular hypertension results from narrowing of the renal arteries, leading to reduced renal perfusion, increased renin release, and subsequent elevation in blood pressure. Conditions like primary hyperaldosteronism involve excess aldosterone production, causing sodium retention and potassium excretion, leading to hypertension. Next, let's discuss symptoms and clinical presentation. Common symptoms include resistant hypertension, which is persistent high blood pressure despite using 3 or more antihypertensive agents, and signs of specific underlying conditions, such as abdominal brutes in renovascular disease or episodic headaches and sweating in pheochromocytoma. Patients may present with symptoms specific to the underlying condition. For example, in renovascular hypertension, you might hear an abdominal brute on physical examination. In primary hyperaldosteronism, patients might have unexplained hyperkalemia. OSA patients often report daytime somnolence and loud snoring. Moving on to diagnosis. Diagnostic methods and tools include a detailed patient history and physical examination, blood tests such as serum creatinine, aldosterone and renin levels, and imaging techniques like computed tomography, angiography or CTA, duplex ultrasound and magnetic resonance angiography or MRA. Important clinical tests include a urine drug screen for suspected substance abuse, sleep studies for obstructive sleep apnea, and blood tests for hormonal disorders like thyroid function tests and cortisol levels. Next, let's describe management and treatment options. Treatment options focus on addressing the underlying cause, such as surgical intervention for renal artery stenosis, and medications like ACE inhibitors, ARBs, or aldosterone antagonists tailored to the specific cause. It's important to be aware of potential complications, including chronic kidney disease, stroke, and heart failure. Medical interventions may involve antihypertensive medications and surgical or catheter-based interventions for conditions like renovascular hypertension. Lifestyle modifications and preventive measures include dietary changes like a low-sodium diet, regular physical activity, weight management, and avoiding substances that elevate blood pressure, such as oral contraceptives in high-risk individuals. Let's illustrate with a case study. A 35-year-old woman presents with resistant hypertension. She reports episodes of transient vision loss and has a family history of stroke. Physical examination reveals an abdominal brute. Diagnostic tests, including CTA and blood tests, confirm fibromuscular dysplasia or FMD. Management includes angioplasty for renal artery involvement and antihypertensive medications. To wrap up, we've covered the essentials of secondary hypertension, including its definition, causes, symptoms, diagnosis, and treatment options. Early diagnosis and management are crucial in preventing complications and improving patient outcomes. Don't forget to engage with our pre- and post-podcast quizzes to test your understanding of this topic. Thank you for tuning in to Med Madness. Stay curious and keep learning.